Questions here are what your interviewer will ask you during your interview. Among other questions, these are just very important ones. First of all,
tell us about yourself.
My name is Ella and I currently work as a care assistant, and I have 2 years of care assistance or nursing experience, during which I have been actively involved in caring for patients across all ages, most especially the elderly that are most vulnerable. And this has broadened my knowledge and exposed me to the basic principles of elderly care, such as optimizing nutrition, ensuring safety and safeguarding, coupled with other knowledge acquired from health and social care courses. This knowledge will be transferred to this working atmosphere to achieve the goal of the organization.
Why do you want to be a care assistant or a senior carer?
I have worked in similar role for 2 years and I get great satisfaction from looking after people, especially those who are vulnerable and need support. Having worked in similar role, I believe in my abilities and I am confident that I will excel in my role and also contribute towards the success of the organization.
What makes you the right fit for this job?
I believe I have the immense level of experience in this role. I'm able to assess and identify the needs of my clients and provide the needed support. I also have good communication and interpersonal skills, making it easy for me to escalate the needs of people under my care to the multidisciplinary team to ensure better health outcomes. I am hardworking, flexible, and able to adapt to various situations and working conditions. My personal values are also in line with that of the organization, and this makes me the right candidate for this position.
What is safeguarding?
Safeguarding is a vital process that helps protect children and adults from abuse, neglect, and harm. It is the duty of every member of staff to safeguard both patients and staff and to provide the right services to those who are unable to protect themselves. As I carry out my daily task, I will ensure patients are protected and any abuse or safeguarding concerns will be escalated to a senior member of staff as well as the line manager.
If you find a patient who has collapsed or lying unconsciously, what will you do?
First of all, I will check the surrounding to see if it's safe to go near the patients. Secondly, I will try to raise the casualty by giving their shoulders a heart check and call their names. Thirdly, if I get no response, then I'll call for help and do a quick ABCD assessment. Fourthly, I will tilt the patient's heads to the back to clear their airways, check for signs of breathing by looking out for the rise and fall of the chest. And lastly, if they are not breathing, I will start chest compression immediately on the patients who are for resuscitation, because not all patients need to be resuscitated.
How would you handle an aggressive or confused patient under your care?
As the saying goes, 2 wrongs cannot make a right. In order to handle an aggressive or a confused patient, I will use a client-centered approach by performing a quick risk assessment to explore the cause of the patient's behavior. I will remain calm, remove them from the situation or environment, listen to their concerns, reassure them, and acknowledge their grievances. I will then give them the opportunity to explain what has angered them or got them upset. I will also seek support from other members of staff as well as family members to get more information about the patient and how to make them more comfortable. I will escalate this to my line manager, document the incident in the relevant paperwork, and complete an accident report. How would you perform a patient needs assessment? Patient needs assessment is a systematic patient-centered approach used in identifying the health and care needs of your patient and putting the necessary measures or plans in place, and also making efforts to meet these needs.
Any question for us?
Do you have professional development opportunities? And secondly, is there anything else I can give you that would be helpful in making a decision? So this is one of the things you have to do before you please go on for your interview. Firstly, you have to go to the company website. You have to familiarize yourself with the company goals, the company's value, mission and vision and all of that. So you get to know what the company is all about. Then in your interview, if you had mentioned ABC, know what ABC is. If you have done your care courses, then you would definitely understand what it means. To say that some patients need CPR, some don't need CPR. Now, CPR is the cardiopulmonary resuscitation, so some patients don't need it. Now, if you're working in a care home, we don't call them patients. They are called residents. But if you're working in a clinic, an hospital, then you call them patients. So another information I think I should give you is that most care homes or hospital, whichever one, used to have either a care plan of the resident or of the patient. So if you need to know about the patient, you might not directly have to go to the parent, or to the children or to the family. You might have to go first to your to your senior colleague to ask about them, or better still, it might also be in the care plan. It could be on a mobile device that is being used within the organization that contains the resident care plan, and you can always get to know about the resident from that care plan. So guys, this information are important before you go ahead for your interview. Thank you so much for having me again. If you know this has been a very good one for you, kindly click the subscription button, and I will see you again in the next video. Thank you for watching.